So today we're gonna continue on the anemia. We're gonna talk about sickle cell anemia, thalassemia, and vitamin deficiency anemia. Sickle cell anemia is one of the anemias that is inherited. It is where when there is not enough red blood cells to carry oxygen throughout your body. In sickle cell anemia, the red blood cells isn't flexible. It is sticky substances in which they get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. Unfortunately, there is no cure for the sickle cell anemia, but there are treatments that can relieve pain and help prevent complications associated with the disease. Next slide. Signs and symptoms usually appear when you are 5 months old. It varies in time from person to person. Anemia is one of the symptoms. Normal red blood cells usually live for about 120 days before they die and be replaced, while sickle cell take 10 to 20 days. This will leave shortage in red blood cells. Without enough red blood cells in your body, your body can't get enough oxygen, which will cause fatigue. Episodes of pain is one of the other symptoms. Pain crisis is a major symptom of sickle cell anemia. When the blood flow gets blocked by sickle cells, pain occurs in your chest, abdomen, and joints. Pain can also appear in your bones. Pain varies from person to person and can last for a few hours to a few weeks. A severe pain requires hospital stay. Some people get a few pain crises in a year, while others get a dozen of pain crises. Some people get chronic pain, which can result from bone and joint damage, ulcers, and other causes.
Rayan, may I just show them a picture of a sickle cell on Google?
What?
May I just show them a picture of a sickle cell real quick?
Yeah, you can.
What happens when you have sickle cell anemia is your cells don't function properly, probably because of genetics. It's the most common
And
cause.
it becomes sticky substances that blocks blood flow and oxygen throughout your body.
This is how sickle cells look.
Swelling of hands and feet. When the sickle cell blocks the blood flow in the hands and feet, swelling happens. Frequent infections. Sickle cells can damage the spleen, which is part of the immune system, leaving you more vulnerable to infections. Doctors give infants and antibiotics to prevent potentially life-threatening infections, such as pneumonia. This infection inflames the air sacs in one or both lungs. We're going to talk about pneumonia in later days. Delayed growth or puberty. Red blood cells provide the body with oxygen and nutrients needed for growth. Sickle cells cause shortage in red blood cells, which can slow growth in infants and children and delay puberty in teenagers. Also, vision problems. Sometimes sickle cells get stuck in your tiny blood vessels that supply the eyes. This can damage the retina, the portion of the eye that processes visual images, and lead to vision problems. Next slide. Sickle cell anemia is diagnosed in infancy through screening programs. Some signs and symptoms that can happen to you. Some signs and symptoms that can happen to you. If you have one of them, visit the doctor. Fever. People with sickle cell anemia can have an increased risk of infection, and fever is one of the first signs. Unexplained episodes of severe pain in the abdomen, chest, bones, or joints. Swelling in the hands and feet, as we talked about. Abdominal swelling, pale skin or nail beds, yellow tint to the skin or white in the eyes, signs or symptoms of stroke. If you notice weakness in the face, arms or legs, confusion, trouble walking or talking, sudden vision changes, or unexplained numbness, or a severe headache, visit the doctor right away. One of the causes of sickle cell anemia is when a mutation in the gene tells your body to make the iron-rich compound that makes blood red and enables red blood cells to function. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become sticky substances that block blood flow. It is inherited. Both the mother and father must have sickle cell to inherit it to their children. If one of the parents passes the sickle cell gene to the child, he or she will have one normal hemoglobin gene and one defective form. This may make both normal hemoglobin and sickle cell hemoglobin. They could have sickle cells but with no symptoms. They are carriers of the disease, which means they can pass the disease to their children.
Okay. So risk factors of sickle cell anemia. Well, basically, the sickle cell anemia, its cause is genetics, and both parents have to carry the sickle cell anemia gene. Both parents of the sickle cell anemia gene, you will probably the baby will probably be born with sickle cell anemia. Also, another risk factor of having sickle cell anemia is sickle cell anemia is most commonly affects black people. We discussed this before. I forgot what disease it was exactly, but when it comes to race, they don't know exactly why. But I think I have. I don't know. I can say that. I don't know. But I think it's based on culture. Honestly. Next slide. Complications. What could possibly happen to you if you get sickle cell anemia? Well, we know that sickle cell anemia has a tendency of blocking blood flow. So basically, any organ or part of your body that blood flow gets blocked from getting access to is going to have a problem. One of those is the brain. If your brain cannot access the blood, it may result in a stroke. Um, any signs of the stroke needs sudden attention real quick and needs to seek medical treatment really quick because a stroke is fatal as we so because let's talk about more details. Sickle cells can block the blood flow to the brain, which results in your brain not getting enough oxygen and dying out real quick. um, acute chest syndrome. This happens when sickle cells block the blood vessels in your lungs, and your lungs cannot access oxygen. And we know that your lungs are used for breathing, and if you cannot breathe, you will suffocate, and you will need emergency medical treatment because of this. A sign of this acute chest syndrome is chest pain and difficulty of breathing. So if any of these pop up, you need to seek emergency medical treatment. I mean, the patient needs to seek medical treatment. Allah yahdikum salam. Pulmonary, the blocked blood flow, it can really mess with the pressure of the blood, especially near the lungs. We know the dangers of hypertension, as we talked about before. Its complication usually affects adults. This is more common in adults. Well, this disease is more common in adults, but this special complication is more common in adults. Shortness of breath, and fatigue are common symptoms of this condition, which can be fatal. Organ damage, as I said in the beginning, the cell can block blood flow. It's just like atherosclerosis. It can block the blood flow. Any organ that doesn't receive blood will end up being damaged. Oxygen damages nerves, organs, including your kidney, liver, spleen, and can be fatal. Other complications, when the sickle cells block the blood flow to your eyes and you end up being blind. Leg ulcers, sickle cell anemia can cause open sores in your legs. Sores are like
What are ulcers?
ulcers.
Ulcers are the spores that happen on your leg. Spores.
Yeah.
What's inside them? Like pus? Like
I think
chemical?
air, and possibly like excess fluids or waste.
Oh, I see.
They can develop and be.
And diabetes cause foot ulcers,
You
if you may recall back.
Yeah.
Gallstones. Who remembers what kidney stones are?
Me.
What are they?
They hurt you when you pee. You pee stones instead of liquid, and it hurts your urinary tract. I think.
Wow, good explanation, Yusuf. I like that. Yeah. So basically, it's when kidney stones is when there's stones that develop in your kidneys and may damage your kidneys and your urinary tract. These are basically the same thing, but it happens in the liver. When when the red blood cells break down, they release a substance called, and if a high level of bilirubin um, develops in your body, it can develop gallstones. Like they combine and become more physical, like stones, I guess. I don't know what to call them, and they may damage your liver. And priapism. In this condition, men with sickle cell anemia have painful, long-lasting erections. Sickle cells can block the blood vessels in the urinary tract. I don't like to use this word that's there, which can lead to impotence over time. Basically, your urinary tract cannot access the blood properly, and you will end up with a painful trip to the bathroom. uh, Pregnancy complications. This is more common in this world. Men cannot get pregnant. Well, sickle cell anemia can end up having pregnancy complications. Can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriage, premature birth, and having low birth weight babies. So, sickle cell anemia can really be effective during pregnancy on the woman and on the child. Prevention. What can you do to prevent sickle cell anemia, or what can you tell people to prevent? Well, basically, if any person has this trait, he needs to make sure to have a to visit a genetic counselor before because the child doesn't have a risk of developing this sickle cell anemia. It's a natural disease, so there's no natural like way of preventing it. It's not like dyslipidemia in which you can like change your lifestyle and you'll be good. It's all genetic. So visit. So a person with sickle cell anemia needs to visit genetic counselor before having a child.